question.
Okay. This is unacceptable, Mr. Lin. This is not acceptable.
Don't worry, Mr. Ling.
Thank you.
Don't worry, Mr. Ling. Dr. Saba gonna check with you in a second.
Hello, Mr. Lin. How are you doing today?
Not so good.
I'm sorry to hear that. Let's see what's going on.
Yeah, so Mr. Ling got an extraction of tooth number 31 last week.
Oh, yeah, I remember.
Yeah.
It was a tough extraction.
That was, but his experience really severe pain now,
Mhm.
and he also said he got some sensitivities. I already took his x-rays, and this is his chart.
Okay. So what kind of pain are you having at the moment?
Like a needle punch on my face. It's so hurt.
And when did it start? Did it start right after the extraction or?
No, really. It
Okay.
happened like in the.
Did you take the medication I prescribed you?
Yes,
You did the mouth rinses?
of
All of it?
course.
What about smoking? Did you have any smoke? I know you're a heavy smoker, Mr. Lin.
I just take one straw on the day of the
We both
extraction.
know it wasn't a one straw, and I precisely told you not to do that. Either ways, let me take a look and see what we're dealing with, okay? Right. That's where the pain's at?
Yeah, it's really painful. Ah!
Okay, this looks like a dry socket. I told you not to smoke. Look at this now. Mr. Lim, after looking at the x-rays and the clinical exam, you do have a dry socket. That's why I precisely told you not to smoke.
But doctor, I follow your suggestions. I do my medication. I do my mouthwash.
I don't care about all of that. You threw it
Hey,
all
doctor.
away. Please, Chin, stay out of this. I told you precisely not to smoke, and now you have a dry socket. This is what happens when the patient willingly does not follow instructions.
But I'm a heavy smoker. I cannot quit smoke.
Well, then deal with the pain. You're here. This is an emergency room. We can't be seeing patients like that just because you decided you want to have a smoke.
But I'm still
This is
painful.
unacceptable, Mr. Lin. This is not acceptable. Okay. Let's write him some prescriptions and send it over to his pharmacy.
But doctor, I have one more question.
Okay, she'll answer all of your questions. Regarding the pain, I already put some medication in there. That should make you feel better. Okay? All right.
Oh my God.
I have to see more patients that are waiting for me. That's it for today. She'll answer anything you have to ask. Goodbye for now.
Don't
Oh.
worry, Mr. Ling. No. I'm
Oh my
sorry,
gosh.
I'm sorry. Yeah, I'm sorry. I really understand that. We'll give you the prescription, and I think you'll feel better soon. And just let us know if you have any questions or any pain. I'm really sorry for that. Mr. Ling, Dr. Shah gonna chat with you in a second.
Hello, Miss Lee. I'm Dr. Shah. How are you?
Good. How are you?
Oh, hi, Dr. Shah. This is Mr. Ling's
Oh,
thermal
nice.
x-rays, and he just here for a regular checkup.
Oh, X-ray looks really good. There's no overlap. All right. So, how are you doing, Mr. Ling? How is your teeth doing?
Feel great.
And how about your brushing and flossing?
I'm brushing every day, but for flossing, maybe once a week.
Once a week, okay. So, is there anything which is like stopping you from regular flossing?
Maybe.
You want us to show you? Sorry to cut you. You can go ahead.
Oh, maybe I'm just a little bit sometimes out of my mind. I cannot remember it.
Oh,
Okay.
don't worry, Mr. Ling. I know a lot of patients tell me it's really hard to keep up with that. I'm gonna show you how to floss later, and maybe find you some way to get it easier, and we can work together.
Thank you.
Oh, that's really great. Thank you, Shane. Yeah.
Welcome.
So we're gonna do a quick exam, and then we're gonna make sure like how is your gums and everything, and then we're gonna let you know what we're gonna do about that. All right? Sounds
All right.
good?
Sounds great.
Yeah, perfect.
Thank you.
No problem. All right, Miss Lee. So on your examination, everything looks good, but except your gums. So your gums were bleeding severely when we checked them. So it looks like you're not doing a good job flossing them. So we're going to discuss that. So make sure you floss after every meal and right after you brush in the morning and at night, and then you gargle after that. So your mouth is really clean. Also make sure your diet is rich in fibers and you're not drinking a lot of sugary food or not drinking a lot of soda. And lastly, to touch base on that, make sure you come back every 6 months so we can take your x-ray. And your teeth are really in good condition right now, so it stays that way.
Okay. Thank you, doctor. I have one question. So I do brush my teeth every day,
Okay.
but I'm not sure if I'm doing the right way.
Oh, don't worry, Mr. Lin. I'm gonna show you later, really soon, really thoroughly, and including the flossing. I think also you need that.
Thank you.
Thank
Doctor,
you, Jim.
yeah, I have one more question.
Yeah, absolutely. Go ahead.
So I have some stain on my teeth.
Yeah.
So is that gonna be treatable?
Oh yeah, sure. Because you're coming back for your hygiene visit, so we're gonna take care of them. Don't worry about it. You're doing a good job. Great
All right,
job. Yeah.
Thank you.